In Good Shape, your weekly dose of health information on Deutsche Welle. Find out more about what's new in medical treatment, alternative medicine, as well as nutrition, wellness, and beauty. Medical professionals, therapists, and counselors are in our studio to offer their expert advice on In Good Shape.
And stopping, even reversing hair loss is the area of expertise of my guest in this studio today, dermatologist Dr. Natalie Garcia Bartels. Thank you very much for joining us.
You're welcome.
Dr. Bartels, androgenetic or hereditary hair loss is caused by a sensitivity to testosterone. We've just seen it in the report. And you can get it at any age, really. How can you know, is there a way to know whether you might be affected in the future?
Well, it helps to have a look at your family and your grandfather or grandmother, but however, it doesn't really tell you how high your risk is to definitely get it once in your life.
Okay, so you might have a look at old pictures, but, you know, don't get scared if your granddad's bald.
Correct.
All right. What about the other form of hair loss that's very common, the one that causes the circular bald patches? Again, it's an autoimmune disease. You can get it at any age. What are sort of very first or early warning signs that tell you have to go and see a doctor straight away?
Well, it's a very painless hair loss, but usually it starts just overnight. And most people then notice that they have some hairs or a lot of hairs on their pillow. So this is one of the first alarming symptoms that even if you don't recognize any patches of hair loss, that if you lose so much hair painlessly, that is an alarming symptom.
Okay, well, let's turn to therapy, something to calm us down. We've had many viewers writing to us on this topic, like Anthony Girma from Ethiopia. He wanted to know if natural remedies like hair oil can help with hair loss.
Well, these are sort of natural supporting agents, like nutritional agents you can take, but they don't have a really serious effect, which you can measure. There are some very much more effective treatments against hair loss.
Dr. Garcia Bartels, who, from your point of view, are the best candidates for a hair transplant?
Usually these are persons like women or men where the hair loss is under control. This is very important prior to an operation, that you really consider that your hair loss has to be stopped and that there no active hair loss is happening to you. Then it's a good point to consider like a hair transplantation if you would like to.
So once the hair has stopped falling out, you take what's left and work with that sort of thing?
Sort of thing, yes. It is really important that the hair loss is under control, because then the hair continues to fall out around the transplants, so the hair density lowers again and the cosmetic effect will be not satisfying.
Okay. Well, let's speak about some other methods. From your work in a clinic, you work in a clinic for hair and skin science. What do you recommend for hereditary or androgenetic hair loss?
Well, we do a lot of research in our clinical research center on this, and now you have nation or international guidelines how to treat especially androgenetic alopecia. So as soon as you know the cause, you can treat, and in these two cases you can use for women minoxidil or as a second line topical estrogens, and for men you have topical minoxidil or oral or systemically taken finasteride. So these are the first line treatments for men and women for hereditary hair loss.
So establish the cause. If it's the hereditary hair loss, use finasteride and minoxidil. How effective are these medications?
Well, you can measure these effects with special devices, and after 3 months, you can have the first effect, which is stop of hair loss, in about 60 to 80% of people who are taking it. After 6 to 12 months, you can have a certain increase of hair volume and hair density, but this depends on the individual stage of hair loss when you start taking it.
All right, so you can't expect a full head of hair fairly quickly. What happens if you stop taking the medication?
The hair loss continues as it was before taking the medication in many cases, but not in all cases. It's very individual course of the hair loss, so it really depends on the activity of the disease. But when you stop medication, you don't expect that it gets worse before.
So you might have to take the medication for a longer period, even for the rest of your life. What about side effects then?
Side effects are usually in the topical medication that you have a certain irritation or itchiness of the scalp. And in the orally taking, sometimes people, men especially, consider that their sexual desire is a little bit lowered. But this goes away when you stop the medication.
Dr. Garcia Bartels, diffuse hair loss can be treated with hormonal therapy. Is that safe?
If the underlying cause is a hormone disbalance, then you have to check the safety of the treatment with the endocrinologist or the gynecologist, because us, as we are dermatologists, we always have an interdisciplinary approach if an underlying cause like this is discovered.
So what do you do if a woman comes to you and is losing hair all over her scalp diffusely, basically? What do you do?
Well, first of all, this is a very severe symptom and it's sort of alarming. And we do a diagnostic approach like we saw in the movie before. And then we see how much is the quantity and then we look for the underlying cause. And this is really difficult in some cases because there can be various causes and it ranges from nutritional aspects, dietary aspects, or severe diseases like thyroid dysfunction or side effects of medications.
Can you help these women in general? Can you help with diffuse hair loss?
Yes, it's much easier because if you know the underlying cause and if this is treatable, then you can help them within 3 months. Then the hair loss will be stopped if you treat the underlying cause.
Okay, it's establishing the cause that's difficult. Well, we've had many viewers writing to us, like Carolyn Chung from Hong Kong. She's suffering from hair loss and she's got an itchy red scalp. What would you recommend?
First of all, I would like to recommend her to see a dermatologist and to get a real good workup of the hair loss. And second, the itchy scalp can derive, for example, from shampoos or other things she's putting on her hair. So maybe she has an underlying allergy, which she doesn't know yet. So this is also an aspect she should discuss with the dermatologist.
Is there anything, to finish off, that one can do to prevent hair loss?
Well, literally, no, it's not possible to really prevent it. It's just that you know that some medication or diets can cause hair loss, that you shouldn't, do a crash diet or something like that. But you can't really prevent it.
Okay, but you can treat it. That's what I've learned today. Thank you very much for being our guest. Thanks for your time.
You're welcome.